Today we have one of our joint ventures between Glaucon and NephCure, part of our clinical trial series, and the talk is titled Immune Tolerance Network and the Advancement of Clinical Therapies, a closer look at membranous nephropathy.
Thank you, Dia. My name is Sharon Chung, and as Dia said, I am a Director of Clinical and Translational Medicine at the Immune Tolerance Network. I suspect many of you are not familiar with the Immune Tolerance Network, so I will start off by giving a brief introduction to the group that I call the ITN. Dia, if you can advance to the next slide. So what is the ITN? So the ITN is a clinical trials consortium where our goal is to conduct clinical trials and translational research. We are funded by the National Institutes of Health, and specifically the Division of Allergy, Immunology, and Transplantation at the National Institutes of Allergy and Infectious Diseases. And we partner with academic investigators as well as pharmaceutical companies to develop clinical trials to induce tolerance as a treatment strategy for immune-mediated human diseases, with the overall goal of improving the understanding of the mechanisms to induce tolerance and clinical outcomes for our patients. We have three main foci. Actually, Dia, if you could go back. Thank you. Autoimmune disease, allergic disease, specifically food and aero allergens, and organ transplantation, primarily kidney and liver disease. And our goal is to advance the application of strategies to induce immune tolerance by conducting high-quality clinical trials emerging therapeutics integrated with mechanism-based research. So unlike many clinical trials that are currently being conducted, one of our main focuses is to have a robust mechanistic assay plan to really understand how we are modulating the immune system with the therapies that we're testing. So we aim to establish new tolerance therapeutics. We want a better understanding of the mechanisms for immune function and disease pathogenesis, and we want to identify new biomarkers of tolerance and disease status. So next slide. So we were launched in 1999. We have conducted over 75 total clinical trials. We've worked with over 250 clinical sites and investigators. We've had over 3,500 participants in our studies, and we have a pretty massive biorepository. Probably for the nephrologists on this call, the study that you may be most familiar with is the RAVE study. So the ITN conducted the RAVE study, which established the role of rituximab as remission induction therapy in ANCA-associated vasculitis. We've also conducted studies in lupus nephritis, such as the ACCESS trial, which looked at the role of abatacept in treating lupus nephritis, as well as the CALIBRATE trial, which looked at the safety of rituximab, cyclophosphamide, and belimumab for the treatment of lupus nephritis. We're currently conducting the VIBRANT trial in lupus nephritis, which is looking at the impact of CD40 ligand antagonism in combination with mycophenolate mofetil therapy for lupus nephritis. We have with regards to organ transplantation, we also conduct studies with kidney transplantation. We have ADAPT and ATTAIN, which is looking at using carfilzomib and belatacept and ADAPT and daratumumab, which is anti-CD38, to decrease donor-specific antibodies prior to kidney transplantation. Next slide. We're looking at establishing tolerance in immune-mediated diseases using three main mechanisms: interrupting effector mechanisms, restraining innate activation, and boosting regulation. And we're currently developing studies that combine two out of these three mechanisms. And the next slide. Just to wrap up, so the ITN is a publicly funded consortium, and so all of our data is publicly available upon publication. You can go to this website, itntrialshare.org, to access our data, to look at clinical data, outcome data, and also to get a sense of what mechanistic samples we have collected. We welcome collaborations with investigators across the globe. If there are studies that you feel, would be supported by our samples, please do contact us, and our contact information is on that site. So that's all I have, Dia, and I'll hopefully be able to turn it over to Patrick at this point.
So I'll try to be brief and move forward. What I thought I would do today is do a brief review of the pathogenesis of membranous, really focusing on anti-PLA2R, review the clinical course and predictors of outcome, and then review some of the principal clinical trials in membranous nephropathy, but spend the last few minutes talking about the trial that Dr. Chung and I have been conducting for the last few years, and hopefully tell you about this. Next slide, please. Next slide. So I'm not going to go over the details of membranous nephropathy as a nephrologist in the audience. You are all familiar with the key features of membranous nephropathy. It is characterized by the deposition, the subepithelial deposition of IgG antibodies against antigens. And in what we call primary membranous nephropathy, the key isotype of IgG deposition is IgG4 antibodies, which is really a very special feature.